Good morning, everyone. My topic for this morning is physiological monitoring and device interface. Now, what is physiological monitoring and device interface? And why is it important in the healthcare setting? Physiological monitoring and device interface is a process of measuring the different parameters in the human body by attaching the patient into medical devices that are capable of reading, storing, transferring, and sharing data among its users for continuous monitoring. Now, medical interface is a computer program that controls a device display for the user and allows the user to interact with the system. Now, here are the reasons why medical devices connectivity is important. First is reduction of errors if not omitted. Next is enables the remote monitoring that allows the physician to monitor the conditions of the patient even he is not within the hospital premises, or allows the nurse to see the condition of his patient even when he is at the nurse's station. Next is it is cost effective. That would be early detection, prompt and accurate medical treatment, and short hospital stay of the patient. Fourth is time saving, life saving, easy work management, and accurate dosing delivery. Now, where do we connect our medical devices to? We connect our medical devices to Wi Fi, data, broadband, or cables. Here are the components of medical device interface connectivity. Number one, physical components. That would be any raw material, piece, or part of the device. Two is smart components. That is the software installed inside the device to enhance better functionality. Number three is connectivity component that enables access to current patient information by measuring and transmitting that information to electronic medical records. Now, here are the examples of device interface. First is smart pumps. Now, what are smart pumps? Smart pumps are devices which uses drug libraries that allows infusion to perform functions that assist with programming and calculating dose rate and delivery as adapted by the healthcare institution to patient care areas. Smart pumps have softwares that allows automatic transmission to the hospital electronic records. And it has also drug libraries of which it stored a list of drugs in the smart pump's memory, being a key to tool to prevent medication error. Each drug has been set into some parameters such as concentration, infusion rates, maximation, and minimum dosages. Now, even smart pumps have their own issues, of which it has two types: the user issue, the device error. With the user error, it happens when the improper programming of the medication, including incorrect dose rate. Also, in selecting incorrect drugs and not reviewing alerts. The last one would be programming the wrong pump channels. With the device error issue, um, it is within the software defects where it is pre-programmed alarms such as do not activates or an alarm that keeps on activating even in the absence of an issue. Next is over or under infusion and out of the date drug library. Now, what are the challenges of infusion pumps, smart infusion pumps? Number one, it is costly. It is expensive to do research and develop device drivers, and softwares. Number two is risk management or security management. Health institution information system transmit and store or use sensitive and protected information. Therefore, mitigation risk and safety, securing the information is as important as safely caring for the patient. That would be your Data Privacy Act. And the last is clinician adoption. Introduction of these medical devices in the healthcare settings must increase efficiency or else adoption of healthcare professionals will not be successful. Can you imagine yourself entering into a smart hospital rooms where every device in that room is connected to a Wi-Fi, where all the information are being stored or transmitted to the hospital system. Now, smart rooms where users are given the real-time location solution or RTLS tracking to bring patient information from electronic hospital record to a computer in a patient's room. Now, in smart rooms, the clinicians are identified with ultrasound badge placed upon their chest up upon entering the room, identifying them to their patients and family members without the need of a whiteboard where you can put all or you can write all the names of the doctors of these patients, managing these patients, and the time of their medical rounds. The room has also patient-centered screen that can be used to identify caregivers, provide schedule of activities for the patient. It has also a screen that can be used to view educational health programs for the patients and family members. It has a direct care touchscreen which helps in the documentation where clinicians can put their clinical observation about the patient, his progress to the treatment plan, even when he is still inside the room of the patient. It provides important clinical attributes such as allergies of the patients, the laboratories, examination results, the diagnostics, and the medications of the patient inside that room. Imagine a smart room like this where everything is connected to a computer. Even your refrigerator, your smart TVs, your smart pumps, even the bed of the patient and the call light and everything else inside that room is being connected to Wi-Fi. Challenges in the medical devices connectivity. Now here are the challenges. Number one, securing the software on the device or It needs a skillful engineer to program these softwares. Number two is delivering software updates remotely and over the air. That would be dependent upon the internet connection, whether it is strong or weak. Now, securing data earlier in semi-public or private cloud, or choosing to embrace edge of computing. Now, when there is connectivity, there is what you call alarm fatigue in connectivity. Alarm is very important, especially for caregivers, because this will give you warnings for emergencies. What is challenging then? That is, the more medical devices, the more number of alarms you will monitor. But at times, you will no longer pay attention to it. But you should not do that. As a nurse, every alarm should be monitored. Alarm fatigue in connectivity also is very challenging to the caregivers, of which they need to respond to multiple alarms produced from multiple devices. Example is in the ICU setting, where there are more medical devices. Each alarm can cause fatigue to the nursing staff. Imagine, imagine your ICU patient where there were 10 or 15 smart pumps attached to the patient or monitors. According to Joint Commission, there may be several hundreds of alarms per day per patient depending on the patient's location. Many alarms are false alerts or nuisance alarms. It is estimated that 85 to 99% of the alarms do not require interventions. So, if you are a software engineer designing the software programs for medical devices, you must be very skillful to do away to design your medical devices in such a way that it will be very useful for the nursing staff and not causing them alarm fatigue. The reasons, the reasons there are some caregivers who don't react as quickly to alarms is because there are some issues with the device itself. As a result, they become immune to the alarms or don't react as quickly. This can lead to patient being harmed. So as I said, every alarm, though they said it would never 85 to 90% of the alarms do not cause any do not need any intervention, but personally for me you need to pay attention to it so you would know what happened to your patient. Health information technology is striving to improve patient safety by reducing medical errors, reducing adverse drug reaction, and improving compliance to practice guidelines. There should be no doubt that health information technology is an important tool for improving healthcare quality and safety. Healthcare organization needs to be selective in which technology to invest in, as literature shows that some technologies have limited evidence in improving patient safety outcomes. Patient safety is subset of healthcare and is defined as the avoidance, prevention, and amelioration of adverse outcome or injuries stemming from the process of healthcare. So Information technology presents numerous opportunities for improving and transforming healthcare, which includes reducing human errors, improving clinical outcomes, facilitating care or coordination, improving practice efficiency, and tracking data over time. Resources to help evaluate the safety of IT system in the healthcare. Number one, there should be firewall. A firewall is a barrier between two networks, identifying and blocking cyber threats while allowing appropriate traffic through. Two is backup. Online backup is the use of a third party service to back up the data remotely over the internet. It is a safeguard providing data management. And the third is an antivirus. It's a kind of software used to prevent, scan, detect, and delete viruses from a computer. Now, here are my references: Essential of Nursing Informatics, Advanced English Dictionary, welchallen.com, BD Alari System, Archimed.com, National Library of Medicine, acog.org, clinician articles, pewtrust.org, hse.gov.uk, checkpoints.com, verizon.com, and HBR organization. Thank you for listening to my report.